Well, good afternoon, everyone, and welcome to the February Pulse virtual presentation with our very special guest, the CEO of Boca Raton Regional Hospital, Lincoln Mendez. My name is Troy McClellan. I'm your president and CEO of the Boca Chamber, and happy February to everyone joining us on the call. This is a pretty special event that we have for you today. Our speaker has been an absolute warrior on the front lines of this COVID-19. He and his team at the hospital have been doing an absolute amazing job keeping our community, our businesses, our residents safe throughout all of this, and continue to now at this hopefully the ending stages of what is this a terrible virus as we break through and more people get vaccines. So Lincoln Mendez is a board member of the Chamber's Board of Directors and has provided us with tremendous leadership outside of during this coronavirus situation, and very much appreciate him and all he does for the leadership team on the board, and of course for all of us here in Boca Raton and all of the Baptist team, of course, an organization that represents us in South Palm Beach County. And to the members of the team, Michelle McGovern and others, thank you for your support and leadership throughout all of this as well. And so we appreciate Lincoln taking time to meet with our Pulse group, our professionals under 40. So everybody on the call better be under 40, except me, of course, because, I have to, welcome. No, Beth, I gave you special permission. Beth, that's okay. Come on. Although you're 41, so no big deal. But we're excited. So we have an hour to spend with Lincoln today. And I just wanted to say hello to everybody. I want to recognize Chairman Sherwood for his leadership with the Pulse Group. It's hard when we can't get together. And, for the past year, the group's been doing a great job. Now Jordan's leadership has really kind of kept it together and given the group the continuity it needs. And we do look forward to very soon getting back together in person with this group and getting back to the business of making sure that the young professional's voice continues to be heard and has a place and makes an impact. Jordan, of course, also serves on the Boca Chamber Board, as you know, and represents your voice, the young business voice on the board and all the important matters of the Chamber. So Jordan, thank you for your leadership of this group. We appreciate it. So with that, again, I just want to say welcome, everybody. Thank you for everything you do. Thank you, Lincoln, for being here. And I'm going to turn it over to your chairman, Jordan Sherwood, who's going to give a proper introduction for our very special speaker today. So Jordan, I'll turn it over to you.
Thank you, Troy, so much. And definitely excited that we're all here today and appreciate Lincoln's time and, coordinating efforts to speak here today. I do want to just give a quick shout out to a couple of my fellow Pulse board members that are here today. Ross O'Connor from Morgan Stanley. I see Gianna Pessinelli from Crocker Partners. This man knows Lincoln very well. Reggie LaRoche from Baptist Health, I see, is joining us today. Also Jamie Diaria from Lynn University and Brandy Applebaum from Office Depot. So a few of our Pulse members and board members here today. Thank you. And quite surprising that we were actually able to get Lincoln to answer the phone, because from what my understanding is over the last couple of months, every time Lincoln has picked up the phone, it has been a vaccination request or question. But definitely appreciate, Lincoln spending some time. And I just want to, before I make the introduction to Lincoln, remind everybody we are going to have some time for some questions to be answered. If you have a question for Lincoln that maybe isn't addressed during his presentation, please put it into the chat. And also reminder to please mute yourself while Lincoln is going through his presentation. So, Lincoln Mendez is the CEO of Boca Raton Regional Hospital. He's been in that position since July of 2019. Prior to that role, Mr. Mendez served as CEO of South Miami Hospital for over 9 years. And before that, Mr. Mendez held the position of CEO at Doctors Hospital for a total of 14 years. So he clearly got into the health field when he was like 10 or 11 years old. During that time and period, he was CEO of Health South Doctors Hospital for 8 years prior to Baptist Health acquisition of Doctors Hospital in 2003. Prior to his employment with Health South Doctors Hospital Incorporated, Mr. Mendez was also the Chief Operating Officer at Kendall Regional Medical Center in Miami, Florida, from 1993 to 1995. He holds a master's degree in health administration from Florida International University, and both a bachelor's of arts in biology and bachelor's of science in medical technology from Southern Adventist University, Allendale in Tennessee. He's a member of the American College of Healthcare Executives and is a licensed laboratory supervisor and medical technologist from the Florida Department of Professional Regulations. He also currently serves as past chairman of South Florida Hospital and Healthcare Association and is currently serving as an alternate for the American Hospital Association or Regional Policy Board. He's also currently a member of the Orangeville Committee, the South Miami Chamber of Commerce, the Great Miami Chamber of Commerce, and the Florida International University Council of 100. He's also served as an adjunct faculty of the Florida International University Graduate Program in Health Administration. And for some, I don't know how he finds time to be probably one of the most avid sports fans that I've been into conversation with. So without further ado, the current CEO of Boca Raton Regional Hospital, Lincoln Mendez, to give us a COVID-19 update. Thank you so much for the time again, Lincoln.
Thank you, Jordan, and it's great to see some of my fellow 40-year-olds on the screen here. That explains that old picture they had to use. They had to dig one up when I was in my 40s. So again, thanks. It's great to be with everyone. Obviously, we live in some exciting times right now, and just not the healthcare industry. I think if you look across the Zoom call, every industry has been impacted by this pandemic. And I thought it would be a good time just to be truly 100% transparent, talk about some of the issues we've been faced with, and start off with just a COVID update. But then as Troy mentioned or Jordan mentioned about the vaccinations, that's really taken a lot of our time recently. And things are changing with that as well. So we're going to be doing that. And I kind of wanted to close off the meeting with just another update on where we are with our master facility plan, the campus expansion. We're excited about that. So anyway, it's a good time to share it with everybody. So here we go. That's not working. Hold on a second. That came out good, right? Okay. So I thought it'd be a good time just to look at the data. So we're getting this from the county. Every couple of days we get an update on that. So you can, they have it broken down. It's incredible how this information is broken down. I've always felt that if you're in the Department of Public Health, if you're a student at FAU and you wanted to do a doctorate, here's your subject matter. Just talk about the pandemic. Plenty of information out there that hasn't been mined yet. All this data hasn't been mined, but it'll be exciting to see what happens in the next few years. But look what's happening with the total number of cases. So keep in mind, these are just positive cases, not hospitalized. These are just positive COVID cases. And remember that 1.8 million. That'll come into play when we're talking about the vaccination. So we've had 1.8 million cases, again, broken down male, female, the average age you can see. Somebody asked one time, well, why are the females outpacing the males? I don't think anybody has any idea about that, what it is. I'm sure we'll know later on, but this is actually the data that we get provided by the state each and every day, and then we have access to it every few days. The interesting thing is, so 4.2% of all the positive cases end up getting hospitalized. Quite a bit. So you can see in Florida, 76,000. You can see the mortality rate has kind of stayed around the same from the beginning. It seems to be slowing down. The mortality rate has decreased. And again, a lot of that has to do with the new treatments that are out there, some vaccination, even though that's too early in the game, I think, to play a role in it yet. But just a lot more treatments, a lot has been learned over the course of the last year, which is unbelievable to think it's been almost a year. Then broken down Palm Beach County, you can see about 115,000. Again, the median age is 40. Hospitalization rate is a little bit higher, and the death, you can see the mortalities are a little bit higher, the percentage. I think that's a reflection too on the county. It's more of an elderly population compared to the rest of the state. So again, this is a great chart too. So we were using this graph quite a bit. Again, coming from the county, you can see I took this off of their website yesterday, so pretty current. So you can again see the number of cases. As a hospital, we like to see how many beds are available. So you look at that bottom left-hand corner, hospital beds available, so 31%, which is great. ICU beds, which is 27%, is really good. And then more importantly, the ventilators. So when we were looking at the first and second wave of this pandemic, these numbers, I can assure you, look totally, totally different. So we were able to see what kind of trends that were going on in the county. Being part of a large system, and I believe George Rizzuto is on the Zoom call as well, and him with Tenet Healthcare, there was a lot of communications going on between all the entities, between Jackson, Memorial, Broward Health, Baptist Health, Mount Sinai Hospital, all the Tenet facilities, HCA as well. We were having to move equipment around. So it's always good to see where we are with ventilator capacity and et cetera. So this is one of my favorite charts. So if you look at your age category, so for you young folks on the call, you're probably going to be in that 35 to 54 range, but this is really a good snapshot of what's going on. So when you look at the age categories, the first column would represent all the cases involved. So you can see the breakdown. So between the 15 and 24-year-old bracket, that represents 15% of the positive cases in Palm Beach County. There's a graph like this for every county. There's a larger graph for the state as well. But for Palm Beach County, you can see where the sweet spot is. It's in the 15 to 24-year-old, all the way to 55 and 64-year-old. There's not a big deviation when it comes to that. So that's where the ones that are testing positive, those are the ones you can just tell fall within that age bracket. If you look at the 75 to 84-year-olds and the 85-plus-year-olds, really a small percentage. They're not the ones that represent all the cases, but they're going to play a role here in a second. So when you look at the new cases, so believe it or not, every day there's new information that comes out. Where did the new cases come from? Again, it's good to see the trends. You can see where the 25 to 34-year-old bracket jumps up. Why? These are the folks that are out there. They're probably not following social distancing. They're going out. They're having a good time. And you can see that this is the age group where the majority of new cases are coming from, even though it's still spread out between those 6 categories that I've highlighted in red. Now, when you get to the hospitalizations, look how everything starts shifting. So now when you start looking at the hospitalization, it's really after the 45 to 50-year-old bracket, that's where the hospitalizations are coming from. If you look back up to the 15 to 24-year-old percentages and the 25, look at the number of hospitalizations. It's really less than 10% when you look at those 2 categories that probably had the highest rate of positivity. And then unfortunately, when you look at the mortalities, look where it's coming from. When you look at the 85-year-old group, where it represented 3% of all cases, 2% of new cases, 16% of hospitalizations, and yet 41% of the mortality. So they it's a tough road for them. This is once you're in those age brackets, your immune system isn't like it is with the younger folks. So they have a little bit tougher road. And if they get into a situation where they get into an ICU setting, it becomes even more challenging for these folks. So again, this represents 96% of the mortalities in a hospital represented from the 55-year-old category all the way up to 85 plus. So this graph is great. Ignore the bottom 2 rows. So this graph we get each and every day from Baptist Health. All this is representing the Baptist Health facilities. That's where it says BHSF, Baptist Health South Florida. So the top graph represents all 10 of their hospitals that have had COVID admissions. So every time you see it's probably tough to read on the call, but every time you see a shaded part going to a light part, that represents a month. So when you look at March, it looks like around March the 8th or 9th is when we had our first admissions in Baptist Health. The first arrow that I have there it was April Fool's Day. That was April 1st. You can see that was our first wave. Wow, that was a shocker. Nobody knew what to expect. Whatever PPE supplies we had on hand, that's pretty much what we had. All the supplies, the manufacturers from China, they had to stop their own manufacturing process. So we weren't getting any supplies during that time. We didn't know how to treat these patients at the time. So it was a hit or miss. You saw the horror stories coming out of New York and New Jersey and in those areas, the the inner city areas where the deaths were just plentiful. They were just coming each and every day. There was more and more. So this was an eye opener for us. We didn't know how to do things quite yet. Ventilators, we were scrambling, trying to get ventilators, et cetera. So you can see that wave really lasted through the end of April. When you look at what happened after that, it was about a 2-month period. Look what happened with the second wave. My theory is that in that 2 months, in between the first and second wave, people just started relaxing. They just, it wasn't here in South Florida as much. We had gone through that primary wave. Everybody kind of, my feeling was we let our guards down. We didn't really practice the social distancing like we should have. Schools were getting ready to get cranked up again, and the spring, everything. All this thing was happening. Well, the second peak you see right there was a major eye opener for us. So the good news is we had a more supplies back then. So the PPE supplies were good. There was issues with, again, we were overwhelmed. All the hospitals were just overwhelmed with COVID admissions. Baptist Health at that time, we were peaking out at about 860 patients within all the hospitals during that period, which is a lot. So this is the primary wave and second wave. So look what's happened with the third wave. So now to put it in perspective, you can see the first and second wave, but look at the third waves. It was definitely a flattening of the curve, but it was lasting a little bit longer. And it seemed like the patients weren't as acutely ill that were coming into our med surg units. They would stay there for a few days. But again, the treatments have really played a good role in this. Even if you're COVID positive, there's some treatments you can do as an outpatient to 70% effective in not getting that patient back into the hospital. Those are things you've heard of, I call it BAM-BAM, but it's bamlanivimab that we can provide on an outpatient basis for that. But again, the testing was great. The treatments, now we're really getting a good handle on these treatments. These EUA treatments like the Regeneron, et cetera, was really working well. So we just saw this wave, and we're kind of, this was as of 2 days ago. So this wave you can definitely tell that it's coming down. Even though we've been wishing for this downward trend for quite a while, it's actually happening now, but this wave was a little bit longer than what we had seen in the past. So again, this is something we get each and every day. So this tells you all the Baptist Health facilities. And if you look at the bottom left-hand corner, right after BHSF total, the first column is really ICU patients. So 61 plus 2, so there's 63 patients right now in the ICU. More importantly, if you look at the far right-hand column at the bottom where I put that star, this is the first time we've been under 300 in months and months and months. Remember that second wave, we were at about 860. So that tells you the difference that we were faced with back then. If you look at West Kendall Baptist Hospital, the last row, they have about 120 beds. At one point, they had over 80 patients with COVID. So just think about that. 80 out of 120 patients had COVID. And again, this is something that was reflected throughout the organization. So just a quick update on where we're at now. So right now we've successfully discharged 1,331 patients. And pretty neat what we do here is anytime there's a new discharge, they play the Rocky theme music overhead. So a lot of folks come down there to the lobby and greet them and just to kind of send them off. And some patients are here for a matter of days. Some patients are here for a matter of weeks. There's no clear-cut answer as to why. Some people respond to treatments, some folks don't respond to treatments. And imagine being in a room for a month. And by the way, without any visitation opportunities, we don't have any visiting hours right now for anyone in the COVID units and the critical care units. So it's even tough. It's more of a burden. So we've turned to iPads and different things like that, just to make sure that family communication exists throughout their stay. Look at the Baptist COVID discharges, almost 12,000. We've had 156 mortalities here since March of 20. Throughout Baptist Health, 1,332. And again, the mortality, the rate of this increase has really slowed down with the advent of some new treatments. Currently, we have 36, and I say that, and this was 2 days ago, and today we were back up to 40. So it's just up and down, up and down. But a few weeks ago, we were hovering between 50 and 60. So there's a lot of encouraging signs out there. And as I mentioned, Baptist has about 290 patients and 298 in-house. So the next thing we've had to do is all of a sudden we were told we're getting some vaccines. So initially you heard about the Pfizer vaccine. That's the one that had to be stored under -80 degrees. And unless you currently live in Minnesota, it was really hard to have a freezer with that kind of freezing capability. So there were only a limited number of places, believe it or not, in Florida that had that. So what happened was Pfizer, everything goes through the state. So Pfizer sends it to the state. The state allocates that for instance, in Miami-Dade County, they were allocating that to Jackson Memorial. Why? They had the deep freezer there. At the time, Baptist didn't have one. So they had the total of, I think it was 19,500 doses that they got initially. So Jackson Memorial, again, in good communication between all the healthcare facilities, they allocated some of those to all of the other facilities. So Baptist Health got 3,000. So out of those 3,000, Baptist Health set up a vaccination center at the Hilton right next door to Baptist Hospital. And that's when our vaccine program started. So everyone kind of started that within days of getting that initial shipment. And again, there's 2 different kind of doses have been, vaccines have been approved by the FDA under an EUA, Emergency Use Authorization. So the Pfizer is a 21-day process. You get your vaccine day 1, 21 days later, you're coming back for the second one. The Moderna is 28 days. So what happened after that initial shipment of Pfizer, we ended up getting Moderna. Everybody wants Moderna because you don't have to have the storage requirements are a lot easier. You don't have to mix the medication versus the Pfizer where you have to mix it with some sodium chloride. So Moderna, you just basically do what they're doing here. You stick a syringe inside the vial and you can pull 10 syringes out of that one. With the Pfizer, it's about 6 doses you get out of that one. So again, a lot of things that we had to learn. Because we were treating patients, we still do, but we had to learn a lot about vaccinations and things like that. And obviously, I put on there the supply and demand. I cannot tell you, the demand out there is incredible. It's incredible, the demand. And I'll just go over some of the things, but here's the National Academy of Medication Allocation. I never knew there was anything like this, but they're the ones that are working with the CDC and coming up with, which group of folks should get it. So everybody in this group, since you're 40, you're probably in phase 4. Healthy adults. So sorry about that. But anybody in phase 1A, 1B, they have to try to figure out some kind of a system where you can prioritize who's going to be getting these vaccines. And this was the best thing that they can come up with. And it was actually a good thing. I mean, the first priority should be those that are most vulnerable. And you have obviously the folks that have direct patient care, the first responders, our police officers, EMT, firefighters, and again, all the nursing home staff. That's another one. So there was a lot of folks in that phase 1A, 1B section. And then you had to get into what about other hospital workers? So that was kind of a phase 1C that coming in and out of the hospital frequently. You don't want those folks to get the virus as well. So anyway, this was a little breakdown that they came up with. And again, I thought it was very effective. You have to start with something. And again, this was all new to everybody. Here's something very interesting. So this got pulled out of GE Healthcare, comes up with their data. So don't quote me on this. I'm just pulling it out of their website, and they provide us with this every few days as well. But look at the percentage of the states that have had, now this is complete vaccination. So that's, remember, complete vaccination means they're fully vaccinated, but that means they've gotten 2 doses, so 2 vaccines. So when you see the number of total vaccines versus the number of fully vaccinated, remember, fully vaccinated requires a first and second dose. So right now, these numbers don't look great when you see, oh, Florida's at 5%, we're doing pretty good. Alaska, I suspect there's only 2 cities in Alaska. So once you get the regular cities done, you're in good shape. But so when you look at this, and I highlighted Florida there, but so look at that. So percent fully vaccinated is 5%, but look at the numbers who received at least 1 dose. So 11% of the population, you can see there, has gotten the first dose. So, and this is increasing. So every time this comes out, the numbers obviously come out. But the important thing is look at the percentage of those that are getting their first dose. So there's only a few that fall under the 10%. So that tells you that the vaccines are getting out there, and at least folks are giving their first dose. But remember, the key is with Pfizer, 21 days you have to wait. With Moderna, you would have to wait 28 days. So by the time you go from one category to the other, you're talking about a month's time. I know Johnson & Johnson's coming out with with a single dose one. We'll talk about that in a second. But again, this is just a good snapshot of what's going on throughout the country. And then as far as vaccines, so look at the total vaccines given in Florida. So 3.4 million have been given. Now, remember, that's 3.4 million. It's when you look at the Florida vaccine series done, you have to multiply that number by 2. So pretty much 2.2 million have gotten their second, the ones that got their second dose, those are first and second. So you multiply that by 2. And then if you take that out of the total vaccines, this tells you there's about 1.2 million folks out there that are just waiting for their second dose. Their time hasn't come yet. But the key to me here was that for the first time, what's happened over the last week or so, the total number of vaccines given, at least a first shot, is more than the number of positive cases in the state. So obviously that trend's going to continue if we see the number of positives going down, but seeing the number of vaccines going up, it's going to be extremely beneficial to keep the spread of the virus down. So if you look at Palm Beach County, about 324,000, again, 96,000 have completed their full complement of first and second dose. So, we're getting there. It's just taking a little bit of time. So Baptist Health, we've given about 31,000 vaccines. At Boca Regional, about 10,000, believe it or not. Baptist only had 3 sites where they were giving out the vaccines. The Hilton, which was able to handle about 1,000 a day while the supplies were there. At Boca, we were able to do about 400, 450, up to 500 on some occasions. We were able to do that as well. So we've done pretty good for just being a regular vaccine, a place that just provided vaccines. But keep in mind, we were never, ever, ever designated to be a community vaccination center. And I think that's what caused a little bit of confusion. The word of mouth is incredible, especially when everybody wants something. And at times we were having people just loitering out here, hoping that there was going to be some extra vaccines at the end of the day. We did not throw one vaccine away. Not one dose was given out, or thrown away, but we have plenty of people on the waiting list to accommodate that. Again, we talk about the Moderna. So the Moderna was determined was 94% effective after you get your second dose. So after your second dose, you wait about 10 days, and that's when you're getting your full complement of antibodies. So Moderna is 94% effective. Pfizer's 95% effective. So one or the other, it's not a big deal. I got the Moderna, and I don't feel like I've lost out or anything. Now Johnson & Johnson's the interesting one. They're saying that single dose is about 62% effective. That's what their studies are showing. It could be anywhere from 60, 65, somewhere in there. But, when you look at that, the good news is that it's a single dose, and you're able to just give this out to a lot more people and not have to worry about that return. Establishing a return and getting a second schedule, that takes a lot of logistics, believe it or not. We weren't set up to be again, a vaccination center and just an open website for people to come in and schedule an appointment. That we were trying to do as much as we could internally just to be able to better manage that. So the interesting, I'll be interested to see what happens with Johnson & Johnson once they get their final FDA approval. But I suspect once the Johnson & Johnson comes out, the storage is going to be a lot easier. This is probably where you're going to see these being given at your doctor's offices and places that'll be very, very, very convenient. The state obviously has, the county has negotiated with the Publixes. So I believe there was 67 Publix stores in Palm Beach County that started giving out the vaccine. I think I read a little earlier today that they're going to start doing it on Mondays as well. I think they were doing Wednesday and Fridays. So they're just making it a lot more convenient for folks to go out there. And this is the right thing to do. We need to get those vaccines out to the community in masses. there, as far as I believe they just signed an agreement too with Walmart and Sam's Club. So again, you're going to start seeing more and more of these. But as more community sites open up, there's going to be less supplies for the hospitals to give. There was a little bit of pushback because some of the folks that were under 65 and had those co-conditions as defined by the CDC, congestive heart failure, pulmonary disease, hypertension. Once you start logging into the public site, if you're under 65, you don't go any further. It just stops right there. So again, the state has given some of the hospitals some additional supplies, but earmarked just for the 18 to 64-year-old bracket with co-conditions, and you're going to have to get a form signed by a doctor. So it's getting a little bit tougher out there. But again, if you're over 65, there's plenty of places to go to try to get a vaccine. So this was interesting, just a nice way to close out 2020 because it's been a hell of a year. All of a sudden we find out about these variants that are out there, that these mutations from the COVID virus, and the one that's been more popular, I guess, is the UK. That was the first one that came out. Then there's a South African variant and a Brazil variant, but it appears that only the UK is the only one that's been identified here in the United States. And you can see where those zones are, and Florida is one of those. So again, we got to keep an eye on this. Supposedly the Moderna and the Pfizer they seem to be working against this variant as well. But again, we're kind of early in the game with that. And I threw this one in too, because it was in the news this last week. It was talking about the 200 cases of the variant, and it happened to be in Broward and Dade County. That was like the hot spots. And if you see on the bottom right, there was an outbreak at the University of Miami. They had to close down the fraternities. That must have been devastating for those students. They canceled the large student gatherings, anything group of 10 or more. So everyone is taking this very, very seriously. The bottom left-hand corner, I actually had gotten an invite to go to a Miami Heat game. I took my son, and I didn't know what to expect. This was the first day that they were actually allowing people to come back. And all of a sudden they had us lined up in these places, and these dogs started walking by us. And I asked the police officer, so what are they checking for? And he says, oh, they're COVID sniffing dogs. So he said that to me. The dog started approaching my 16-year-old, and I was convinced he was going to get mauled because every kid probably has the virus. So anyway, but just very interesting how the times we're living in. This I just threw out there because just like we have to fight the flu, the virus, everything, you got to do everything that we've talked about, getting the vaccine is the flu shot, washing your hands, covering your face, staying at home. If you think you're sick, stay at home. This goes not just for the COVID, but also for the flu. But I want to show you this next slide, which was interesting. Look at how bad of a flu season we've had this year. This is the flu, not COVID. This is just the flu. But look at that. We've had throughout the nation, it's been minimal. And I personally feel that a lot of the safety things we're doing now, wearing a mask, the hand hygiene, social distancing, we've probably prevented the flu from spreading like it normally does. This would have been a double whammy if we had a normal bad flu season with on top of the COVID. That would have been devastating for hospitals. But thank goodness this was a very minimal flu season. So with that, I'm going to jump into our Keeping the Promise campaign. And really, keeping the promise is really the promise that was made by the folks in the Boca community to build a hospital there, because they felt that they needed a hospital in the Boca community. And it was after a tragic event. There wasn't a hospital in Boca. The community got together and said, we need to build a hospital here. And through fundraising, a lot of grassroots efforts, the community pulled together in 1967. They opened up a hospital. It was called the Miracle on Meadows Road. So this campaign of the expansion is really to modernize the facility, but keeping the promise that we're going to maintain a facility here for this community. So just some quick slides, just showing you what the construction projects are. So you can see right here, there's 4 different projects. On the top right-hand corner is our central energy plant. The second, the number 2 item is going to be our Toby and Leon Cooperman Medical Arts Pavilion. Number 3 is a parking garage. It's going to be right across from the Medical Arts Pavilion. And obviously number 4 is going to be the new structure that's going to be going up on the campus. And again, phase 1 is a central energy plant. All these things I'm going to show you are going to be LEED certified, all these construction programs. So again, latest technology, You can see for instance, the front of this building, it's facing north, so it's away from the neighbors. And that acts kind of like a sound barrier, that material that you see right in front of you. And on the back side, it's going to look nice. It'll just look like a building. There's not windows in there that'll be distracting. So the key is we're going to be landscaping that whole back area. It's going to be very, very nice, being sensitive to the neighbors that live behind us. And we just wanted to look as nice as possible. The pond has become a topic of discussion because obviously that structure that I showed you is gonna come over some of where that existing pond area is. So we started taking a hard look at this, and it just made sense to just build a new pond. The pond in front of the hospital is not a retention pond or anything like that. It was just a regular pond. So we're gonna build another one in kind of like in a park-like setting, all the way to the west side of the campus. So you can see this is Meadows Roads going east towards the hospital up the four-way stop sign. And you can see how beautiful that's going to look with the park on the side. And you can see the remnants of the hospital on that end. And then real quickly, phase two and three, this is a medical arts pavilion, the parking garage. Again, it's going to look really, really nice. This is the patient tower coming in from Meadows Road. So this is what you'll be looking at. Just going real quickly through these. Again, on the top right-hand picture is going to be the lobby area. It's going to be an atrium, a two-story atrium, so it's going to look absolutely beautiful. The picture you see on the bottom right are kind of some of the corridors that lead away from the atrium. So you see there's going to be a lot of room, a lot of relaxing areas. The left-hand will be, the bottom left-hand corner is what one of the patient units is going to look like. Again, very, very modern. It's going to have all the bells and whistles in there. We're making this a digital showcase for Baptist Health. And the top left-hand picture is going to be our new bistro. So it's facing towards Meadows Road. So that'll be one of the first things you see when you come up. And phase 5 is going to be renovating our old tower. So this is going to take a lot of time and energy as well. Anytime you renovate an old structure, you have to be getting it up to code. So you pretty much have to gut out floors at a time and then just rebuild. And in there, you can see where there's this is probably going to be the Troy McClellan nurses station in the future. And then again, one of the things that we wanted to do is there's a lot of buildings coming up and a lot of modern structure, but we wanted to keep that sanctuary green space. We wanted to keep that relaxing environment where people can just go off, relax, and it's just not going to look like a building complex. And then quick time frame of when we're doing everything. Everything in blue is on design. So believe it or not, even during the COVID and the vaccine, we're still having a lot of meetings with the architects because we can't lose any momentum. We have a lot of things that have to be meet some deadlines. So you can see the central energy plant, the medical office building, all that is under construction. And we hope to start seeing the building across from Meadows Road as you're leaving the hospital. There's an old building, the address is 745. That's gonna be the first thing you see demolished. So that'll probably be demolished in the next few months. And that's where the new medical arts building and the parking garage across the street is gonna be located. And then the other thing we wanted to do is we challenged the architects. We wanted to keep that historic charm of Meadows Road again. So there's going to be some movement with like we're going to expand the sidewalks a little bit. So we wanted to make sure we keep the greenery in place as well, and not lose that charm that's located there now. And then last but not least, the healthcare heroes. I love this slide. All the superheroes that are just paying their respects to all the healthcare workers. So they've done an incredible job during this pandemic and now the vaccination process. And we've got a great team here in place. And they've done an incredible job in responding to the pandemic and to the needs of the community. And couldn't be any prouder of them. So with that, I am going to stop sharing. And if there's any questions.
Jordan has questions for you.
Jordan has a question.
Yes, yeah, we have a couple of questions from the crowd. So I guess, just first with the Pulse committee and all its members kind of being a volunteer and looking to give back, are there volunteer opportunities for those who would like to support the vaccine rollout?
Well, we're actually in this phase, we're almost to the point where we're getting out of the vaccine. We stopped doing first doses for the most part a couple of weeks ago, and that was just through supplies. Again, more vaccines going to Publix, there's not any vaccines for us to give. And to other community sites as well. So eventually we'll get out of the vaccine business and let the community take care of that through Publix, Walmart, CVS, all those other places.
So I guess that's great. So I guess off of that then, Lincoln, like what do you expect to happen in the next 3 months in Palm Beach County, given the vaccines? Are less beds going to be used, but COVID testing positive going to be up? What's your kind of an overall analysis on that?
Well, the COVID testing is going to still be the way it is. If I've been told that some of the community COVID testing sites, they're seeing a decrease in volume right now. So all the signs are indicating that we're kind of getting on the other side of that curve, but it'll depend if there's, who knows, I'm hoping there's not going to be another fourth wave, but there's always going to be a steady flow of COVID patients coming in through the hospitals. I just think it's going to take a while for all of this to be cleared up as well. So we're going to be in this COVID game for, I think, the rest of this year, but God willing, with the vaccines getting out there, people taking them, we'll start seeing less people getting infected.
And I guess, speaking of the vaccinations, Lincoln, and you also touched upon Johnson & Johnson, what would you tell someone who had a preference over receiving one manufacturer over another?
At this point, I don't think that's a luxury item. You can't pick what you want. It's whatever's available. And I think you take whatever's available. And if, another question too is this going to be a yearly occurrence? It could be. I just don't know if, that's been determined yet. So are we going to we're going to have to do another 2 shots of Moderna or Pfizer or another single dose in the future. But I think that's the big unknown. So right now, I would just encourage you to take whatever's available. We actually had somebody come to the vaccination center and they'll say, oh, I want the Pfizer. So, okay, well, we don't have it. So good luck with that. But, common sense took a hold real quickly and they ended up taking the Moderna vaccine.
One of our Pulse board members, Brandy Applebaum from Office Depot, wanted to know, it looked like women were having more positive cases than men in the country and the state. Mm-hmm. Was that also reflected in the mortality rate, or is it reversed?
That's a great question. I don't know the answer to that. I haven't seen the breakdown in the mortality rate. The one common thing about the mortality rate, it was your age. That was the key, but that's a good question. I don't know. I don't know the answer to that. Sorry, Brandy. But
well, I guess you just have to come back.
No, I'm gonna have to check that. That's a great question. I got to check that county website and see if it's even in there, if it's broken down that way. That's a great question.
The group is also asking about adolescents with health issues. Maybe someone waiting for a kidney transplant or is on dialysis. Will they get the vaccination? And can you touch upon that?
Yeah, right now what the state has told us is you have to be between 18 and 64 for that category that's got other conditions. So if you're over 65, it doesn't matter. You're over 65, you can get the shot. The hard part is the ones that are not 65. So if you're between 18 and 64, that's why they set aside some allocations. And those, because of the comorbidities, depending on what it is, they've asked the hospitals to do that first, just because we know the physicians, the medical staff, some of our centers of excellence, they can identify those patients fairly quickly. Now, I have not seen anything where it's under 18. I don't know if any studies have been done regarding how safe it is for somebody that's 6 years old or 10 years old waiting. That I don't know. That's not to say it's not out there, but I think the bottom line is you ask your doctor. You ask your doctor, what is it that I need to do? But right now, we're only authorized to give between those between 18 and 64.
The group was also curious, Lincoln, just about your team and the healthcare professionals on the front line, how you're working with them, as it relates to maybe some mental health issues down the line, because they're dealing with such strenuous situations every single day.
Yeah, I mean, that's a great question too. So we do have, all the facilities have like a pastoral care department. We actually have a psychiatrist employed from years ago, not just because of this. So they're providing, they actually go out into the nursing units and just talk to people and just see, how everything's going. But everyone reacts differently, and There's nothing like that support you're getting into the units as well. These are like bands of brothers, you know, especially within the units, and especially in the COVID floors, the ICUs, they have to be going through a lot of stress, but anytime they need anything, we're there to provide them any kind of support that they need. Baptist Health has some other programs that they can participate in, but you have to be on a constant watch for that. You know, everybody's got issues at home, and then they have to come to work. Your kid, you might have your kid that has to do tele education, and they're, you know, who's going to babysit their kid, and who do you bring in there, and you're exposing yourself. So there's a lot of, you know, the healthcare workers are going through a lot right now. So keep them in your prayers.
When someone brings up to you, Lincoln, fear about it coming back winter of 2021, how do you respond?
I hope not. I hope it doesn't come back. The key is going to be the vaccinations. If these things work and they get more people out there, you heard about the herd immunity. So the less people that can get infected, it's just going to reduce the number of people getting infected. So, but I don't see us getting away from the mask and the washing your hands, social distancing. It's going to be a while. You know, I remember looking at pictures from Tokyo and, you know, Hong Kong and places, and you go, oh, I can't believe those people are wearing masks. There was a lot of people wearing masks. Now I freak out when somebody's coming towards me without a mask. I'm like, oh my God, you know. So I think it's just going to be the new norm for a while until this thing is completely eradicated, and that's going to be a while.
Looks like you survived all the Q&A. I think we got them all. And your great teammate Michelle McGovern also put up a link to Florida Department of Health website in case anybody on this call or afterwards has some other maybe questions that weren't answered. Some great information that's available there. So thank you, Michelle, for that, and thank you, Lincoln, for the time that you spent today with that. Troy, anything to leave our group before I just update everybody on the next event?
Yeah, no, just again, Jordan, thank you to you and the board and the group for putting this together, and Lincoln for sharing your time. I know you don't have a lot of extra time on your hands right now, and Michelle, thank you so much. This is really important information, and the data that you've shared is really critical for us to understand what's happening. You know, give us a little bit of perspective about what's out there. You know, clearly the message is, you know, that you know, when you can get your vaccine, you should. And it's important, I think, for all of us to understand. I mean, everyone on this call is wicked young, so they're down the road before they can actually get their vaccine. But this information is just really important for this leadership group to understand, so that they're talking intelligently out in the community with their colleagues. So just thank you, Lincoln, for that. Appreciate it. And Jordan, go ahead. I'll let you wrap up.
Yeah, thank you, Troy, and thank you again, Lincoln, and the rest of the team at Baptist for dedicating some time. Just want to remind this group that our next event, we've got another great speaker on tap, Dan Kane from Modernizing Medicine. He's going to spend some time with us. That event is already scheduled for March 16th, again at noon. So you can visit the Chamber website to make sure you reserve your seat for that. It will be, again, a virtual event. Hopefully down the line, as things back to normal, we'll be able to be in person, but certainly excited to hear Dan's story. It's a great one, so looking forward to that. And if that's the end of the presentation and the call, I thank everybody for joining today, and look forward to seeing everybody soon. Just be smart, be safe, and be healthy.